so true. And for many of the physicians who are colleagues of others who may be experiencing burnout, even if they're not psychiatrists, how can they actually recognize it in other physicians, and what are the warning signs, and what can we do to intervene? Because sometimes it could be a helpless feeling as you watch your colleague exhibit some signs and symptoms. What do you recommend, the recognition, and then what do you do?
Sure. Well, I think that's actually one of the main reasons I wrote the book, because what the book is about is it's actually about the lived experience of being a physician, and a physician who's having difficulty. Now, whilst all of the cases in the book relate in some way to physician suicide, in reality, it's really a book about the stresses that occur and that affect physicians, and with suicide just being one end of the spectrum. So when I get asked the sort of question you've asked me, it's really interesting because there's very little on the lived experience of what it's like to be a doctor. There's lots of TV shows, and they tend to be over-dramatic, as we both know.
Yes, yeah,
they don't tend to actually really talk about the constant, continuous low-grade pressures that are on us and how does that impact us. So really, my first aim for writing the book was just to write a number of stories of what it's like to be a physician, in this case, a physician in distress. Now, what do we look for? I mean, we look for primarily symptoms of burnout, because that's the most common disorder. Burnout is characterized by three sort of major components. People who are just feeling very tired and exhausted, people being cynical about their work, thinking of patients as numbers or cases, and people losing meaning in their job, forgetting why they went into medicine in the first place. And you can get those sorts of impressions from people just in a simple conversation. People get irritated, they get cross, it's obvious that they're distressed or frustrated or disgruntled about their work. And so in that situation, I mean, the best thing to do is to try and just join with them. And sort of sympathize. We all understand how they feel. Most of us have been through these sorts of feelings, and to offer them sympathy, offer them someone to talk to if they wish. Many will not want to talk to you immediately about that, and that's fine. But what you're trying to do is to get involved in a process of engagement if they're really distressed. So that either they'll talk to you, or they'll agree to go and talk to someone else who's more expert, or they'll talk to their spouse, and just sort of gradually start the sort of journey towards perhaps getting treatment and care if that's what they need. Having said that, most people who have symptoms of burnout, the symptoms resolve spontaneously over time. Something happens, life changes, they may even get a different job, or they get a new boss. And things are improved. I mean, one thing we know about burnout is that 80% of burnout is probably caused by organizational things.
Fascinating.
It's not caused by individuals, and so we've got to get away from the culture of blaming doctors for having high levels of burnout, which is what used to happen. I absolutely never do that. And I think what we've got to do now is really examine the systems we work in and the pressures that are on us. And that's where, if we can change those systems, that's where we'll find we can make an impact on the levels of burnout in our profession.